China, you're muted.
Hello. I would like to thank everybody for being here, and welcome to Early Steps Family Orientation. Um, I would like to thank Wallace for assisting me with this presentation. So thank you, Wallace. Um, if anybody has any questions, yeah, I can put those questions in the chat box. Um, I also have Miss Melinda assisting. Um, she's on here as well. So we'll go ahead and we'll get started. Thank y'all. Okay, so we have our first slide, which is Lacan, and I'll go ahead and have Miss Melinda give y'all some information regarding this slide. Go ahead, Miss Melinda.
Great, thank you, China. So, LACAN stands for the Louisiana Council's Advocacy Network. This is a group of moms, dads, professionals, people that care about people with developmental disabilities, and special education advocates across the state. In each area of the state, there's a team and a team leader like myself. So the area in New Orleans has one leader for both areas of New Orleans because it's so big. So there's actually 9 of us. And my goal is to connect you to your policymakers. I don't know if you saw the uh, news this morning, but there was stuff on the news about people from Lacan parents that were testifying about restraints and seclusions yesterday at the legislature. That's just one of the things that we're working on this year. In light of the discussion about federal cuts, another thing that we're talking about is protecting people with developmental disabilities from cuts to services. And then families helping families funding. We would like to continue to getting the funding that we've been getting for 3-4 years now. It's not part of the budget, so every year we have to come back and have a discussion about it. I'm sure there's other things that are going to come up. And then as soon as June, I can't remember if it's the 5th or the 7th, as soon as legislative session ends, we go into the community input meetings where we start talking to people on our teams about uh, what they want to work on next legislative session. So it's sort of a cycle that keeps repeating itself. I help people come up with stories that they can use on individual meetings with their legislators, on round tables. Every year we have a legislative roundtable where we have legislators come to hear about what we're working on that year and to hear people's stories. So I help you do that. Some of those people will go to Baton Rouge and testify. Uh, Sometimes you'll just bump into your legislator out in some kind of event and you might have a chance to tell your story. So those stories are important. It's free to join. Basically, you're saying that I'm willing to get the emails. You'll get some emails that are action alerts. So I would appreciate it if you would take some kind of action that we talk about on issues that are important to you. And, uh, you know, hooking you up with your legislator is my main goal. Right now, working on those legislative visits is my big activity. So y'all join. Wallace, I'm sure, dropped the link in the chat. He does that. Wallace is wonderful. It doesn't cost anything to join. you're agreeing to get the emails and maybe attend some of the different things that we talk about and maybe tell your story. Y'all drop it in the chat if y'all have any questions. Thank you, China.
Thank you, Miss Melinda. Okay, so what is EarlySteps? EarlySteps is a system of support and services designed to enable families to help the child progress developmentally and improves their child's functions within their daily routines. Who is eligible? So the child must be from birth to age 3. Live in Louisiana, must be diagnosed with a medical condition or resulting a high probability of resulting in developmental delay, or experiencing developmental delay as measured in the BDI-2. These are the areas of eligibility that they look at. They look at physical, cognitive, social, and emotional, adaptive, and communications. And you have to have a delay in 2 areas. So it has to be either physical and cognitive or cognitive and communications, so in 2 areas. The autism screening, parts of the evaluation includes a screening process to identify the child's risk for autism. When a child has a positive screening, the family will receive options to address next steps. So this screening is completed at the initial, the annual, and the exit. The evaluation for the child is at 18 months or older, and the evaluation is or at the request of the family. Okay, so just to let y'all know that this screening is not stating that your child has autism. So it is only a risk assessment. So what they do is once the screening is done, they give you this screening for you to take to your physician and say, okay, so this screening was done, and we need to look further into this and say, we need more testing. So that's what this screening is for. It's not to say, oh, yes, my child does have autism. It's to take to your doctor and say, there's a lot of red flags stating that he has a high risk of autism. It's showing a high risk. So we need to dig further into this. And so that's the reason for the screening, not to say that, yes, he does have autism. Okay. Family cost participation. This was implemented in 2013. If your child has Medicaid, then the cost is free. If your child has if you have private insurance, then what they do is they do a sliding scale and see how that child will be billed to your private insurance. Okay, so they gather the your financial information at the beginning of the IFSP process, and then they throughout your early steps process, they every so often they will go through your finances and gather that information and do an update, and they will do an update and update that information every so often. And so, but like I said, if you have Medicaid, then your child service will be free. So they do it that particular way. You will receive an EOB statement for billing. I always try to explain to my family that you need to be checking to make sure that your service is provided when your service is provided. So whenever your provider is coming in, you need to mark on your calendar your service was provided at that particular day on that particular time, so that when your EOB comes in, your EOB is explanation of benefits. When your EOB comes in, you can go back and you can say, yes, this service was provided on this day at this time. Because at the end of the month, you have to check off and sign saying, yes, you did come in, you did provide this service. So they can't be paid unless you sign saying, yes, they did come in and they did provide this service. If you sign and they didn't come in, then that's on you as a parent. So you have to be the one to give that okay for that provider to be paid. Okay? So that's why I always try to explain to my parents, you have to be the one to keep up with those payments. Okay? Okay. How does the EarlySteps system support families with eligible child? We will go over 4 goals throughout this presentation. 1 is to help you understand how your child develop and learn. 2 is to communicate your child's needs. 3 is to help you understand your rights while in early steps. And 4 is to have a successful transition through early steps or at age 3, or at exit. So 1 is to help you understand how your child develop and learn. To meet this goal, your child's team, which includes you as a parent, will design supports to address the needs of your child and families to include 1 or more of the following as needed. So 17 services are offered through early steps. That does not mean that you will receive all 17 services. Through the assessment that they will do, they it through that assessment they will figure out what services is needed for your child. So whether or not that will be special instructions or occupational therapy or physical therapy, or nutrition services, whatever services is needed, y'all will be able to figure that out through that assessment. Okay. And so y'all will go from there. If you feel as a parent that OT is needed, occupational therapy is needed, but that was not that did not come clear on the assessment, then that's something you as a parent can discuss once y'all have y'all get to the table, and then y'all start discussing and going over the plan. You can discuss that and say, this is why I feel as though occupational therapy is needed. Okay, so you'll have your opportunity to put your input in and, be able to explain why you feel as though these services are needed. Okay, so goal 2, to help you understand your rights in early steps. Every family in early steps is guaranteed the following rights, and the goal to ensure that they understand the rights. So written prior notice, use of parents' native language, parent consent, confidentiality, examination of records, accept and decline services, resolution of disputes, and child rights to a surrogate parent. Okay, written prior notice is provided for a reasonable time before EarlySteps propose, refuse, or initiate any activity or change for the child or the family. So everything needs to be in writing. So if you have a meeting, it needs to be in writing. If you have a service, a change to a service, add to a service, it needs to be in writing. Your meeting location needs to be in writing. If you change the meeting location, it needs to be in writing. Everything needs to be in writing, okay? The time of your meeting needs to be in writing. If you change the time of your meeting, it needs to be in writing. Everything is in writing. Remember, nothing can be proposed or changed unless it is given to you in writing before it happens. Okay, the native language. So everything needs to be given to a parent in their native language. So if you speak Spanish, it needs to be given to you in your native language. If it's if you blind, if that family is blind, then it needs to be given to that family in Braille. Okay, that's something that we need to work on ahead of time to make sure that all of these things are done so that it can be given to that parent in their native language. Okay. The notice is translated orally or by other means to the parent in the parent's native language or other mode of communication. The parent acknowledges, understands of the notice, and there is written evidence of these requirements have been met. So it needs to be given to the parent in their native language. Okay. So like I said, that support coordinator, that FSC needs to be working on those things ahead of time so that it can be given to the parent in their mode of communications. Okay. Consent. Okay. The parent have been fully informed of all information relative to the activity for which the consent is sought. This information was provided to the parent in their native language or by other appropriate modes of communication. The parent understands and agrees in writing. Remember, everything has to be in writing to be carried out for an activity for which consent is sought, and the consent form describes activity and listed records that will be released and to whom the records will be sent. The parent understands that granting of consent is voluntary and can be revoked at any time. So this program is voluntary. Nobody is holding you up against your will saying that you have to do it. And if you don't, that we're going to call the cops. No, this program is voluntary. So at any time you decide that you no longer want to participate in EarlySteps, it's free will and you can walk away at any time. So EarlySteps is a voluntary program. Okay. Just so you know that. So if you feel as though you have 5 services going on, you have OT, you have PT, you have special instructions, you have a case manager, an FSC, and you have I'm trying to think of the other one, nutritionist coming into the home. That's 5 different services. And you also have you're taking them back and forth to the hospital, and you have out, you know, um, um, uh, therapies on the outside going on. Um, so that's a lot of things going on. So it's a revolving door of doctors and hospitals and people coming in and out. And so you're overwhelmed. And if you decide that you just have too much going on and you want to eliminate some of those services, you definitely can with EarlySteps. Okay. So if you want to remove your nutrition services, your PT, your OT, with EarlySteps, you can. So that only leaves you with your special instructor and your FSC. So you only have those 2 services going on with EarlySteps. Okay. But you still have all this other thing going on with outpatient care at the hospital, and you're still going back and forth to NICU, and you're still going back and forth, to the emergency room, and all of these things going on. And you're still trying to keep up with your special instructor and your FSC, and but it's still overwhelming for you. You can still eliminate your special instructor and still have EarlySteps. So now all you have is your FSC, and you can still have EarlySteps. Okay. So I like my parents to know that you can eliminate all of those other services and still have EarlySteps. As long as you have your FSC, which is your case manager, through EarlySteps, you can still receive EarlySteps services. Now, if you remove your FSC from EarlySteps, then you will no longer have EarlySteps services. But as long as you keep your FSC, then you will still have EarlySteps services. Okay? You can remove all other services and keep your FSC and still have EarlySteps services. All right? So I like my parents to know that, because a lot of times my parents have called me and said, me and my providers did not get along, so I dropped EarlySteps. Yeah, but you know that you could have called me and said, I don't like my provider, and we could have called your FSC and said, I don't get along with my provider. Could I be placed with another provider? I didn't know that. Well, yeah, you could have called and said, hey, could I be placed with another provider? And we could have tried to find you a different provider. Okay. Or if you had an issue with your FSC, we could have called the FSC supervisor and say, hey, I'm not getting along with my FSC. Could you switch my FSC? Then that's something else that we could have worked on, and say, hey, I'm not getting along with my FSC. Could I have switch my FSC? Some of those things are some of the things that we can work on without you having to lose your EarlySteps services. Because in the end, it's the baby that loses out, and not the FSC or not the parents. You know what I'm saying? So we're trying to make sure that the baby is the ones that's not losing out in the end, because that's who actually loses out in the end. So we try to work around those types of things. Okay. Okay, so confidentiality. EarlySteps ensure that information of your child and family is protected. The child's name, the parent's name, of the family member's address, personal identifiable information, a list of personal characteristics, and other information that makes it possible to identify their child with a reasonable certainty. So yeah, I always give the example that we live in a, we have a lot of small rural areas. And so we try not to give out too much personal identifiable information because because we have a lot of rural areas. So yeah, we try to be very, very sensitive with those personal identifiable information. Examination of records. Parents have the right to inspect and review their child-related information. EarlySteps responds to the request no later than 10 days. Copies of such information, such as the evaluation and IFSP, is at no cost to parents. Other information, if you need copies, and they make you copies, and last I heard, they were like 10, 15 cents a page. So yeah, parents may also request that records be amended if they believe that the information is inaccurate or misleading. EarlySteps will consider the request and make the decision in a timely manner as well. Accept and decline services. We kind of spoke about this earlier. Without jeopardizing or losing any services, as I stated earlier. The only time that you will lose services is if you eliminate your FSC. You can remove all of your services from EarlySteps. As long as you keep your FSC, you will maintain EarlySteps services. So and what I always try and tell my parents is, let's say you remove your special instructor, your your PT and your OT, but you still have your FSC. And then 2 months later, you realize, man, I removed that OT, but I see that my baby really and truly did need that service. You can always call your FSC and say, I removed that service, but man, he's doing real bad, and I really do need that service back. Then that's something that you and your FSC can talk about. And, y'all can talk about getting that service back and having that service, having that service replaced back to his IFSP, added back to his IFSP. So that's one of the things about keeping your FSC, because you were overwhelmed at one particular time, but now things can kind of calm down. And so now you can talk about having some of those services added back to his IFSP. Okay. So that is one good thing about that as well. Okay, dispute resolution. There are 3 ways to resolve a disagreement. One is a complaint process. Parents, service provider advocates, service coordinators, members of the SICC, employees of public agencies may file an individual complaint. A complaint must be filed in writing and must contain the following information: a statement that state has been violated, a requirement of Part C, IDEA, or the regulations therefore, the facts describing the allegation complaint, the name, the address and phone number of the complaint, the person filing the complaint, and a proposed resolution of the problem. So that's the first one. That's the complaint process. I'm not real sure. I have been here for 14 years. It made 14 years in September. I've never ever made it this far to the complaint process. Like I've always said, most of the time, when I've had a parent called me me and my supervisor, most of the time we can have things resolved by talking to the parents, and most of the time either changing out the provider or changing out the FSC. In my 14 years, I've never really made it this far to the complaint process that I can remember. Not that I ever remember making it to the complaint process. Um, so yeah, we've always been able to avoid this process by working with the parents and having the issues resolved, because, like I always try to explain to my parents, let's try to work those things out before it gets that far, you know. And I try to always talk to my parents about, not dropping their services because we can try to figure things out. I don't want my babies to lose that particular service because the parents are unhappy. You know, um, I never want my babies to go without because the parents are unhappy. So I want to make sure that my parents are happy so that my babies can get what they need. That's always my ultimate goal, to make sure my parents are happy so that my babies can get what they need. If I have to go here, if I have to get to this point, I will, so that my babies can get the services that they need. But in 14 years, I've never had to go here. But if I have to, I will. I will, so that my babies can get what they need. But because for me, it's all about my babies. But yeah. Okay. So the second is mediation. It is an attempt to resolve a concern between two or more parties through the objective intervention of a neutral party. Families are offered to have their concerns addressed by an impartial mediator. Department of Health offers mediation through the Division of Administrative Law. Mediations is also referred as an administrative conference. Mediations is voluntary and may result in a binding agreement between both parties. Okay. And then the last is due process hearings. These due process hearings is DHH also calls them an appeal of fair hearings. The hearing is evidence is presented by both parties, and both parties may be represented by attorneys, and witnesses may be called. The written decision is given within 60 days, and the proceedings is provided with no cost. While the hearing and everything is going on, the services that's not under dispute can still be given, and information about all parents' rights are provided to families through their time in EarlySteps. Okay. Rights of a surrogate parent. Children's rights in EarlySteps is also protected. And so if no parents can be identified, if a parent cannot be located for a certain period of time, and if the child is a ward of the state. So these situations are according to the law of Louisiana. Lead agencies might assign someone to act as a surrogate parent. A lot of times, this is typically used when DCFS is involved. Okay. So goal 3 is to help families effectively communicate their child's needs. Here we're gonna start talking about developing the IFSP. So this is where we're gonna talk about putting the child's plan together. So we're gonna talk about how the team talks about the CPRs, which is the concerns, the priorities, and the resources. So the role of the other team members is to assist you in communicating the needs of the child and the family. Okay. Each eligible child and family must identify the IFSP, and it should be developed no later than 45 days from the date of the referral at the SPO. Can't get it out. So the IFSP must be developed jointly by the family and appropriate personnel involved in early step services, be based on the evaluation and the assessment of the child and the family, which was discussed by the CPR, and includes supports necessary to enhance the development of the child and the capacity of the family to meet the needs of the child. Okay, how is the IFSP? And the IFSP needs. This is the continuation. Be developed at a meeting, reviewed every 6 months or more often if needed. Be evaluated and revised at an annual meeting. Follow a standard form, which is designed by EarlySteps. Address transition of the child at age 3 or at exit, and obtain a parent's consent before being conducted or before services is provided. Who is part of the IFSP team? The parent or the child's guardian, other family members, or as requested by the family, an advocate or an outside person that's requested by the family, the initial intake coordinator, ongoing service coordinator, which is your FSC. I typically say case manager, but your FSC. Person directly involved in conducting the evaluation or the assessment. Person who will be providing the early intervention services, which I typically say, which is your provider. Or the EarlySteps EI consultant, which is your early interventionist. Okay. So now we're going to talk about your CPRs, which is your concern, your priorities, and your resources. And so how this works is your FSC, which is your case manager, typically goes in at a meeting, and she sits with the family, with the parents, and she'll talk about your daily routine. And she'll say, let's talk about your daily routines, and let's talk about how things go throughout the day. So tell me what a typical day looks like. So when you get up in the morning, what do you typically do? How is it brushing his teeth? How, what does breakfast look like? What do y'all typically do after breakfast? What do y'all do for lunch preparation? What do y'all do after lunch? Does he take a nap? How is nap time? What do y'all do after nap time? And go through the whole entire day. How's supper? How's meal time? What does meal time look like? How long does it take you to feed him? What does bath time look like? How long does it take you to bathe him? What does grooming look like? How is toilet training? Is he being potty trained? Those types of things. What does bedtime look like? How is your bedtime routine? So, from the time he gets up to the time he goes to bed, they want to know everything about the whole entire day and routine. If he has siblings, they want to know how he interacts with the siblings, so they want to know the ins and outs of the whole day. So We're actually getting down to the nitty gritty and putting everything together. Okay. So after she finds out about the whole entire day, then she wants to know about your concerns about the whole entire day. Okay. What parts bothered you about the whole entire day? So like for example, when my baby went through EarlySteps, and so after we talked about the whole entire day, she wanted to know what was my concerns about the whole entire day. So um mine's was feeding times. It took me 2 hours to feed him. So for breakfast, it took me 2 hours to feed him breakfast. It took me 2 hours to feed him lunch. It took me 2 hours to feed him dinner. He had separation anxiety issues, so I couldn't, go anywhere without him being hooked to my leg. So if I had to go in the kitchen and wash dishes, he was hooked to my leg while I was washing dishes. He didn't want to stay in his room, for 5 minutes and play for 5 minutes by himself, so that was some of my concerns. So she was writing all that now. So then she was like, okay, so now we have down all your concerns. How do you want to prioritize these concerns? Like, what do you feel is most important to you? I was like, uh, feeding time is a huge concern for me, because I feel like it takes up too much of my day to feed him. So I wanted to work on feeding time. Separation anxiety was a huge concern for me because I wanted him to spend at least 5 minutes in his room. He had speech issues. Speech issues was a huge concern for me. I wanted him to be able to talk. He had speech issues. I wanted him to be able to speak. Um, so she was like, okay, so what was your number one concern? I said speech was number one. Then food was number two. Then separation anxiety was number three. I did not know I was making my goals. So my number one goal was speech. My number two goal was separation anxiety. My number three goal was no, my number two goal was food. My number three goal was separation anxiety. Okay. And then she asked me, okay, is there anything that you feel as though you need any type of assistance with, any type of resources that you want to look into? And I was like, well, I heard Kid Team had a long waiting list, and writing therapy um, may be a good resource for him. And so she put Kids Team down. She put writing therapy down. That was a resource. So I did not know, by talking about all of these things, that I was creating my IFSP, and we were talking about my CPRs, which we were. I was thinking that we was just having a conversation, but she was creating my plan. So that was my CPRs and my IFSP. So I've just, by having this conversation with you, I've just basically told you all of the IFSP and the CPRs in one, so, which is exactly what she did for me. And I did not realize it, but, but yeah. So that was our conversation in a nutshell. And she actually had put my whole plan together, and I did not realize it. But yes, that's how it was. So the IFSP outcomes. So by us discussing those things, we had to talk about the IFSP outcomes. So we had to make my outcomes measurable. So like we discussed when we talked about my son's speech and his language, at the time, he would only say the last words that I would say. So if I said, there went the yellow bus, he would say bus. So he would only say the last words that I would say. So he only had a vocabulary word of maybe 10, maybe 10 words at the time. And so I wanted him at the end of EarlySteps to be saying 25 words. So that was my outcome. I wanted him saying at least 25 words. When we talked about, I had said it took me 2 hours to feed him. I wanted at least an hour to feed him. So I had said it as a joke, not realizing that I had already set an outcome. I was like, man, it takes me 2 hours to feed him. If I could at least get to an hour, I would be happy, but I didn't realize that I had already set an outcome by just saying that, and so, and I had also did the exact same thing about, the separation anxiety. I was like, man, if he could just stay 5 minutes in his room so I can take a shower, I'll be good. So I had already set an outcome by saying that. And so she was writing those things down. And so by the time we got to outcome, she was like, well, I have an hour for meal prep. I mean, for meals, and I have 5 minutes, for his outcome for being in his room, because I heard you say that. And I was like, oh, okay. So she had already had those things written down because, just me talking and running my mouth, because I'm always talking and running my mouth, she had already had those things written down. So, but yes, that's how you get your outcomes, because you want your outcomes to be measurable so that you can be able to see, like, at least we've reached the goal by the time we've come to the end of my 6 months or the end of my year or the end of my 2 years. We can show a measurable outcome. We can show a measurable goal. Okay. Okay, so these are just some examples. You will get a copy of this PowerPoint and you can kind of go over the examples on your own. Okay. Let's see what the top of this say. Okay, when should I make changes to my IFSP? Request a meeting if your child is not making progress after several months of services. If your family feels overwhelmed over the amount of services that's provided. If your child has made progress and does not need as many services. So this is when you can make changes to your IFSP. Okay, parent roles and responsibility as a team member. Participate in your IFSP process. Participate in service provider plans and carry out activities with your child. Share knowledge of things that you observe. Inform your support coordinators of issues that may affect the child's services. Schedule visits during time that's best for you and your family. Be on time for your scheduled appointments and write down any questions that you may have, and be prepared to discuss what happens at your since your last visit. What I like my parents to know is that when your providers come in and provide those services, that you as a parent need to be in there with that provider, watching that provider, learning those skills so that you can continue to provide that service once that provider is gone. Because if not, then your baby is only receiving an hour of service. Okay? I want you to realize that, because you are supposed to continue that service once that provider is gone. Okay? Otherwise, your baby will not learn that skill and be able to move on to a new skill. Okay? All right. I want y'all to know that. Because if that provider is in there providing a service and you're in the kitchen washing dishes, or you're in the laundry room doing laundry and she leaves, then your baby only has that 1 hour of service. Okay. The other thing that I want you to realize is a provider is not supposed to come into the home with a toy and provide a service and then leave with that toy. Because how are you going to continue that skill if you don't have that toy? Okay. Whatever she goes into that home with, she either leaves that toy there or she's supposed to be using a toy that's already in the home. Okay. All right. Because if she leaves with the toy, you can no longer provide that service because you don't have that toy. Okay. So I try to express that to my parents so that they know to express that to the provider. Okay. Because if you don't know to express that to the provider, then that provider's gonna go in the home and she's gonna bring a toy into the home and teach that child a skill, and she's gonna leave with that toy, and then you cannot continue to teach that child that skill. And that child will never learn that skill because you don't have that toy to continue to teach that skill. Or that parent is going to have to go out and buy that toy. And not all parents have the funding or the funds to be able to go out and buy every toy. So that's the purpose, that they're not supposed to go into the home with that toy if their parent does not have that toy. Okay, so they're supposed to use a toy that's already in the home, or they're supposed to leave that toy in the home if they're going in the home with a new toy. Okay. Some toys, EarlySteps have, we used to have toys that we used to donate to parents. So I don't know if we still have toys that we donate, because that's something that they did a while back. So I'm not 100% sure if they still have toys that they donate. That may be something that you need to ask the provider whenever they go into the home. You can ask them, hey, do y'all have toys that y'all donate? Do you have any particular toys that you can use that's being donated? So ask them that before they decide that, they're going to use those particular toys. So ask them that. All right. Let's see. Ask to be shown anything that you do not completely understand. Review your monthly cost participation, the EOB. I stated that earlier. Review and sign each provider's contact notes for each session. Use strategies throughout the day with your child and make notes of work and what does not work. Okay, remember that. Use those strategies throughout the day and make notes of work and what does not work. Because if it's not working for you, then you need to go back and you need to inform that provider, this strategy is not working. We need to try something different. It makes no sense to continue to do something that's not working. Okay. Be open and honest with with your service provider. Do not be afraid to ask questions. And participate in the SICC and the RICC. It used to be that you had to leave your home to participate in those. You no longer have to do that. We do them by Zoom now. So you can do it on your phones, you can do it on your computers, you can do it at work. You don't even have to leave anymore to be able to do those. All you have to do is contact me and I can get you the information. I can just email it to you. Okay. All right. Let's see what this says. Goal 4, have a successful transition out of EarlySteps when it's time to exit. Early Steps is committed to supporting your child and family through exit at age 3 when your child is no longer eligible, if your child relocates out of the state or leaves the system for any reason. Okay. Transition. Intake or FSC, discuss transition at every IFSP meeting. Ask you what supports you need to make to have a successful transition. Design steps to meet the needs to the steps to meet the needs you identify. Have a transition conference prior to exit and invite the school or other representatives to attend and provide information for you. Okay, your FSC, your support coordinator, means the activities carried out by individuals to assist and enable an eligible child and family to receive the rights and procedural safeguards of services that are authorized to be provided. So your FSC responsibility is to provide ongoing service and supports while you're in Early Steps, coordinate ongoing evaluations and assessments for the child and family needs, coordinate the provision of Early Steps services, consult with other service providers and representatives, inform families of their rights, collect financial information, arrange and conduct the meeting, understand and represents best practices and guidelines, facilitate the transition meeting, review the IFSP for the family quarterly, every 6 months and annually, and assist families in accessing other services and supports and resources in the community. And then information on the providers. A lot of times family gets the roles of the providers and the FSCs mixed up because the providers are in the homes more often. So they're always asking the providers to do the jobs of the FSC. Okay. Your FSC is supposed to be like your best friend because your FSC is the one that's supposed to be doing all of those things. Your FSC is supposed to be the one that's supposed to be finding out about the resources in the communities and supposed to be finding out about all of your different services and things like that. But a lot of times the families are asking the provider to do those things because they're always the ones in the home. And a lot of times the providers try and help and they try to do those things for the families because they feel like they're so close to the families because they are always in the homes. Sometimes that is what creates the tension between the families and the providers. So, which we always try to tell our providers, instead of doing that, call the FSC and tell the FSC, okay, your parent is asking me to do such. Can you call the parent and discuss those things with the parent? So that the provider's not doing those things. But some providers do, but not all. But yeah, to try to, cut the tension. But it doesn't always work, but sometimes it does. But yeah. So the role of the provider is to educate and inform parents of strategy skills needed to learn and accomplish the child's outcome. Assess and evaluate a child per the request from an FSC, provide ongoing supports and services according to IFSP, consult with parents and providers to ensure the effectiveness provision of supports and services, attend the IFSP either through team meetings, in person, by phone, or in written report, and submit monthly progress notes to the FSC by the 10th of every month. Okay, here are more examples that you can kind of read over once you receive the PowerPoint. And then helpful tips. Okay, who do I contact? These are some of my favorite, some of my favorite parts of the PowerPoint, because it's always my thing. Like, I want to know who I need to talk to, if nothing else. Who do I contact? When I have questions about my IFSP, who do I contact? The FSC. When I need to schedule a team meeting, the FSC. If I need information about the resources, the FSC, or the COS, which is myself, or Families Helping Families, which is still this office. If you need information about the child's disability, you can contact the FSC, myself, the COS, or Families Helping Families. If you want any information about the SICC or the RICC, you can contact myself, the COS, or the regional coordinator, which is Patrick Juno. If you want to meet other parents that is in EarlySteps or support group, you can contact myself, the COS, the FSC, or Families Helping Families, which is here. Or if you would like to file a complaint, you can contact MCAL. I can always provide y'all with that contact number. 337-475-3100 is MCAL contact number. And then tell us if we have reached our goal to review the 4 main goals that we went over. Help your family be able to help their child develop and learn. Help your family communicate their child's needs. Help your family understand their rights, and help their family experience a successful transition at age 3 or at exit. Okay. And then this one is talking about the feedback and the survey. So at the end of this presentation, they will be having a survey. Like Miss Melinda always say, if you do the survey, we get brownie points. So that is all. Do y'all have any questions? Do we have any questions in the chat? Any at all?
I'm not seeing any yet.
Okay. Well, I do appreciate y'all taking the time out to sit with me for an hour and go over this information. Just to let everyone know, my position as COS will be eliminated. Across the state, they are eliminating all the community outreach specialist positions. So Patrick Juno will actually be taking over the community outreach portion. So if you need any information, you will have to contact Patrick Juno. He is actually located through MCAL. I say MCAL. He's actually not. I can actually give y'all his contact number. Let me give that to y'all. If y'all actually need him, y'all can call him. Let me give y'all Patrick's number. Because that is who y'all will have to contact from now on. Okay, so Patrick's number is 337 488-0749. So he will now be the contact for Region 4 and Region 5 Early Steps for this particular area. So if you need anything dealing with Early Steps, Patrick Juneau is now the contact person. My last day is June 30th. I am here till the end of this fiscal year, June 30th. And after that, all contact for Early Steps will be Patrick Juneau. So now that I've said that,
Well, and you can actually call Families Helping Families too if you need to. We still
yes.
have
Oh,
staff
yes,
here that will
definitely.
work with the 0 to 3-year-old group.
Oh, yes, definitely.
Yes, ma'am.
You can definitely still call Families Helping Families. We will never, ever turn anybody away. Never, ever. If you call here, we will still do an Early Steps referral. We will still give you any Early Steps information, anything like that.
And there is a link in the chat to the Early Steps transition webinar that'll come up and start at 1.
Yes. And I will be doing the Early Steps transition right after lunch. So if anybody would like to attend, please register and we'll see you then.
Thank you, everybody, for attending.
Thank you.